Hello everyone. I am Smit Patel, and in this video, you will come across various aspects of ethnopharmacology. Now, what is ethnopharmacology? Many of the medicines we rely on today, from aspirin to morphine to the anti-cancer drug, Taxol, were derived from plants. The cross-cultural study of medicines derived from naturally occurring substances like plants and fungi is known as ethnopharmacology. Although these plants have often been used in traditional medicine for many, many years, there's still a lot to learn from them. Formal definition of ethnopharmacology is the interdisciplinary scientific exploration of biologically active agents traditionally employed or observed by man. If I talk about the concepts, the ethnopharmacological approach toward the understanding and appraisal of traditional and herbal medicines is characterized by the inclusions of the social as well as the natural sciences. Anthropological field observations describing the local use of nature-derived medicines are the basis for ethnopharmacological inquiries. The multidisciplinary scientific validation of indigenous drugs is of relevance to modern societies at large and helps to sustain local healthcare practices. Especially with respect to therapies related to aging-related, chronic and infectious diseases, traditional medicines offer promising alternatives to biomedicine. Bioassays applied in ethnopharmacology represent the molecular characteristics and complexities of the disease or symptoms for which an indigenous drug is used in traditional medicine to variable depth and extent. Here, I would like to describe an indigenous-led project run by Keki Maya healers of Belize meant to strengthen and improve traditional botanical healing. The goals of this project were to conserve medicinal plant knowledge by way of ethnobotanical studies, and to conserve the plants themselves by creating a community ethnobotanical garden. A total of 169 medicinal species were collected in the ethnobotanical survey, which provided unique knowledge on many rainforest species of the wet lowland forest of southern Belize, not found in neighboring indigenous cultures. Consensus on plant uses by the healers was high, indicating a well-conserved, codified oral history. After horticultural experimentation by the healers, the indigenous botanical garden provided a habitat for and conservation of 102 medicinal species, including many epiphytes that were rescued from forested areas. Ethnopharmacological studies by the university partners showed a pharmacological basis for, and active principles of, plants used for epilepsy and anxiety, for inflammatory conditions such as arthritis, for dermatological mycoses, and for type 2 diabetes complications. Overall, the project has provided a model for indigenous empowerment in First Nations science, as well as establishing traditional medicine as an important, unified healing practice that can safely and effectively provide primary health care in its cultural context. A historical example. If I talk about the oldest documented example, according to a text written sometime before 2500 BCE in Samaria, a man laid in his bed with a broken leg. He was in a lot of pain and needed to sleep so his leg could heal. Luckily, he managed to get some medicine derived from a common flower, which was known to him as the joy flower. He took it and soon his pain decreased and he began to feel better. Today, we call the Sumerian joy flower the opium poppy, and we still use it to make medicines to ease pain. The common painkiller morphine is derived from the opium poppy, and it also can be used to make drugs such as heroin and codeine. While the famous opium poppy has certainly proven to be extremely important in medicine, it's far from the only plant to have medicinal properties. For thousands of years, people have used naturally occurring plants, including the opium poppy, to treat diseases and relieve pain. Modern-day examples of ethnopharmacology. First is milkweed. The white sap from this common weed, also known as petty spurge, a good treatment for warts. Milkweed made its way from its native Europe to Australia. In 1997, Dr. Aylward isolated its active ingredient, ingenol mebutate, which he discovered was toxic to rapidly replicating human tissue. And recent clinical trials of Picato, a gel derived from milkweed sap, suggest it is effective at stopping lesions turning into skin cancer. Second is leeches. Leeches were one of the more civilized methods of bloodletting, a popular cure for disease. For the ancient Greek physician Hippocrates, any imbalance in the four bodily humors means blood, black bile, yellow bile, and phlegm would cause disease. And the best way to correct this was to drain the excess off in blood. Fast forward to 1830s Europe, and bloodletting was big business. Today, hospitals such as UCLH in London use these bloodthirsty worms to drain excess blood after microsurgery, which helps to promote natural healing. They can be used in postoperative care of skin grafts, or after lost fingers and ears have been reattached. Third is willow. Crack willow tree. Both the ancient Egyptians and Hippocrates recommended using the bark of a willow tree for pain relief. Its effectiveness was eventually proven in a study by the Royal Society in 1763. But it was not until 1915 that drugs giant Bayer started selling it over the counter as aspirin. It is now the subject of between 700 and 1,000 clinical studies each year. And recent advances have shown it is far more than just a painkiller. From reducing the risk of strokes to indications it could help prevent cancer, aspirin is the traditional remedy that keeps on giving. Next is snowdrops. Galantamine, derived from snowdrops, and now used to treat Alzheimer's disease, was first investigated by the Soviet Union, but folklore tells of Bulgarians rubbing the flowers on their forehead to cure headaches. Last is cow's stomach juice. A recipe for eye salve from 1,000-year-old Anglo-Saxon medical textbook, Bald's Leech Book states onion, garlic, wine and cow's bile should be crushed together and left in a bronze vessel for 9 days and nights. Now, tests have shown the eye salve kills MRSA in the lab faster than the best antibiotic. Why I took this topic? As I am a clinical pharmacist, pharmacology is my favorite area. And the field of ethnopharmacology is like studying ancient pharmacology. I know nature is the mother of modern medicine. The initial idea we get about the drug molecule is from nature. So, I like to read about pharmacology. For more information you can access the following resources. Let's discuss the following questions. Thank you for watching the video.